Cassidy is my next guest today. Welcome back. You were here a few months ago, and today I know we're going to talk about maternal health, pregnancy being one of the most exciting times of a woman's life, a family's life, but also extremely overwhelming. What is UnitedHealthcare doing, Dr. Cassidy, to encourage healthy births?
Yeah, so we've got great, obviously, services for women during their pregnancy and then for young babies once they're born to make sure that people are getting all those wellness checks and things that they need to do to make sure they're engaged with their physician and healthy. We've also got some very specific support programs. So actually, a UnitedHealthcare member could go onto the UnitedHealthcare website, and there's actually healthy pregnancy programs where they can actually have nurse support and be plugged in so that they, can get their individualized needs met to make sure they're not feeling overwhelmed and they can make good choices to have a healthy pregnancy.
Great support for them through this. Very important to carry that baby full term if possible to 39 weeks. So don't schedule early delivery for convenience sake, right? Is that part of the message?
We have such a high C-section right here in the United States, and we do think a great deal of that is related to people scheduling inductions or, quite frankly, scheduling their C-section because they want the OB that's been seeing them through their pregnancy to be on call the day they deliver. And where I understand that relationship issue, I think you really have to be conscious of the fact that C-sections are really tough on moms. It's a major surgery. There are some complications that babies have related to C-section delivery. And then full-term babies are healthier babies. So if you can take your baby to full-term, be patient, wait to go into natural labor, there's some real benefits to the baby as far as brain development, gaining some weight, making sure you have healthy, mature lungs before delivery. Real important time those last few weeks. So try to make it to term as a very good plan.
Do C-sections, when you say they can have an adverse impact on moms and babies, on the babies, what are some of the adverse effects on a baby through a C-section?
Yeah, so a baby born by C-section, sometimes they'll have some respiratory distress after delivery. There's that kind of squeeze factor from a vaginal delivery we think really helps clear fluids from babies' lungs. And then babies, if they're under stress related to surgery, they can swallow meconium, which is stool, which can cause problems. Not every C-section is an avoidable C-section, and there are some babies that have medical problems that need C-section. But a C-section for the sake of convenience surely is not something that would be in the best interest of the mom or the baby.
And you say that again, our numbers are much higher in the U.S. than around the world.
About 1 in 3 women, just over 30%. It's like 32% was the last statistics I saw for 2014. It's really high. It's definitely high when we consider, when we compare to other countries, advanced countries, Western countries across the world.
Expectant mothers can follow certain steps to help ensure they deliver a healthy baby. What are some of those steps? Educate us on some of those steps.
Yeah, so much of healthy pregnancy, they're the same things we talk about for healthy lifestyle. I think the difference is we really want you plugged in with that OB early and doing those prenatal visits to make sure everything's going well with your pregnancy. But a lot of the other stuff is stuff we talk about all the time. Eating healthy, getting plenty of rest, getting exercise. You absolutely can exercise through your pregnancy. Making sure you're a non-smoker. If you are a smoker and you're planning a pregnancy, working on quitting prior to getting pregnant is just really important. One of the major causes of low birth weight babies is tobacco abuse. And then alcohol consumption is something we recommend that you don't do during pregnancy. And then obviously illicit drug use would be something you want to not be doing during pregnancy. And reaching out and asking for help if you're having issues.
Let's discuss various birth settings and the risks that can be associated with where you have the baby.
So in this country, most people deliver in a hospital-based setting. That's not true in all countries. Some countries really do a lot of home deliveries. I think the important thing is that you want to make sure that you have an OB who's following you closely, and that if you're considering an alternate setting, your OB is in agreement that that is a safe setting for you. And then you really also want to check with your insurance provider, because there are some variations depending on health plans on what is or is not covered, so you want to be careful with that. So I think you definitely need good medical advice if you're looking at an alternate setting, and definitely to make sure that your insurance carrier is going to be online with that, and you'll have good coverage if you do choose an alternate setting.
this kind of works its way into the next question I had, really, to make plans to prepare for the baby's arrival, which could also include maternity leave and lactation kind of classes. Can you elaborate on those things?
Yes, we definitely strongly encourage breastfeeding. I think breastfeeding has a lot of benefits for a baby, particularly as far as their immune system development, but also for moms. I mean, when you're breastfeeding, it really helps to get that uterus clamped down and back into normal size. It helps women, some with weight loss, because you're using a lot of calories to make that breast milk. It can really be helpful to moms as well. Breastfeeding, I think the myth of breastfeeding, there's two. One is it's really hard and nobody can do it successfully, and the other one is it's natural and easy. And I think the truth really is in the middle. Reading some books about breastfeeding, taking advantage of lactation consultants, which are typically available at most birthing centers. They're really very helpful and can help you get started. And then, I think there is a little bit of a gap where some of us don't have moms who breastfed anymore. But if you have a friend, a mom, an aunt, someone in your community who's breastfed, that'd be a great support person for you, because it's someone who's really been there, can help you walk through it.
Makes sense. Resources that you could recommend to new moms out there watching, or expectant mothers? Are there some good resources through UnitedHealthcare, I'm sure?
Yeah, so the Healthy Pregnancy web, if you get on the UnitedHealthcare website, that Healthy Pregnancy link will take you to a lot of resources and connect you also to a lot of other websites that are out there. And then Childbirth Connection is also another really good website that has a lot of information out there that women can access to see what resources may be out there to help them.
Childbirth Connection, okay. And as we wind up in the last 30 seconds, any other tips to moms to maybe give them some kind of comfort in the final weeks of their pregnancy?
Honestly, if you're taking care of yourself and being gentle with yourself, which I would want every pregnant mom to, I would want everyone to do, but every pregnant mom in particular to do, usually what's good for the mom is good for the baby. So take good care of yourself, make sure you're getting the things that you need, and let yourself naturally go into labor, and I think hopefully things will go really well for you.
Great. Okay, thanks so much again for
your
time, Dr.
You're welcome.
Cassidy.
Thanks for having me.
Good to see you, and we'll be right back.